Etoposide, also known as Toposar Vial, is a medication used to treat testicular cancer and certain forms of lung cancer, such as small cell lung cancer. It works by slowing the growth of cancer cells. It is important to take this medication as prescribed by your healthcare provider. The daily dosage and optimal timing for taking Toposar Vial will depend on your specific medical condition, so be sure to follow your doctor's instructions carefully. When using Toposar Vial, it is important to follow the instructions given by your doctor. This medication is administered through a slow injection into a vein by a healthcare professional. Typically, it is given over a period of 30 to 60 minutes, either daily or every other day, for a total of 3 to 5 doses. This cycle may be repeated every 3 to 4 weeks. It's important to be aware that this medication may cause low blood pressure. If you feel dizzy, it's important to inform your doctor or healthcare professional. They may need to adjust the injection or administer it more slowly. The dosage of Toposar Vial is determined based on your medical condition, body size, and response to the treatment. Your doctor will regularly check your blood counts to ensure that you can safely receive your next cycle of medication. Make sure to attend all your regular medical and lab appointments. Some side effects that may occur while using Toposar Vial include nausea, vomiting, diarrhea, dizziness, tiredness, weakness, changes in taste, loss of appetite, pain/redness at the injection site, temporary hair loss, and pain or sores in the mouth and throat. Your doctor may prescribe medication to prevent or relieve nausea and vomiting, and eating small meals or limiting activity may help lessen some of these effects. It's important to brush your teeth carefully, avoid mouthwash with alcohol, and eat soft, moist foods. This medication may lower your ability to fight infections, so it's important to tell your doctor if you have any signs of infection. Additionally, it may rarely cause acute leukemia, and a serious allergic reaction is rare. Remember that this is not a complete list of possible side effects, so it's important to speak with your doctor or pharmacist if you have any concerns. If you're taking Toposar Vial, it's important to be aware of the potential for severe blood and bone marrow problems. This may result in low red blood cells, white blood cells, or platelets, which can affect your body's ability to stop bleeding or fight infection. Be sure to contact your doctor immediately if you experience unusual tiredness, signs of infection like a persistent sore throat, fever, or chills, or easy bruising or bleeding such as black stools or bloody vomit. It's essential to stay vigilant and communicate any concerning symptoms to your healthcare provider. Before using Toposar Vial, make sure to inform your doctor or pharmacist about any allergies you may have and the details of your medical history, specifically any blood, liver, or kidney problems, previous radiation or chemotherapy treatments, and heart issues. Toposar Vial may increase the likelihood of getting infections or worsening current infections. It's important to avoid contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. Speak to your doctor if you have been exposed to an infection for further guidance. It's crucial to inform your healthcare professional about using Toposar Vial before getting any immunizations or vaccinations. Also, stay away from people who have recently received live vaccines. To minimize the risk of cuts, bruises, or injuries, be cautious with sharp objects and avoid activities such as contact sports. Toposar Vial may cause dizziness, and alcohol or marijuana can intensify this effect. It's advised to refrain from driving or using machinery and limit alcohol consumption. If using marijuana, consult your doctor. Daily use of alcohol while using this medication may increase the risk of stomach bleeding. It's wise to ask your doctor or pharmacist about safe alcohol consumption. Prior to any surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of Toposar Vial, especially allergic effects. Older adults may also be more sensitive to certain side effects, such as drowsiness, weakness, mouth/throat sores, loss of appetite, low white blood cells, and dehydration. Toposar Vial can affect fertility in both males and females. Consult your doctor for more details. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as Toposar Vial may harm an unborn baby. Reliable forms of birth control are recommended for women during treatment and for 6 months after the last dose, and for men during treatment and for 4 months after the last dose. If pregnancy occurs, seek medical advice immediately regarding the risks and benefits of this medication. This medication passes into breast milk, and therefore breastfeeding is not recommended while using Toposar Vial. Be sure to consult your doctor before breastfeeding. When taking Toposar Vial, it's important to be aware of potential drug interactions. These interactions can affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. This will help them determine the best course of action and ensure your safety. Never start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with a healthcare professional before making any changes to your medication regimen. If someone has taken too much Toposar Vial and is experiencing severe symptoms like unconsciousness or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Before using Toposar Vial, it is important to undergo lab and medical tests, including complete blood count and kidney/liver function. It is crucial to keep all medical and lab appointments and consult your doctor for more details about these tests. Make sure to take each dose of Toposar Vial as prescribed by your doctor. If you happen to miss a dose, it's important to consult with your doctor or pharmacist to establish a new dosing schedule. Be sure to follow the product instructions and consult your pharmacist for details on how to store Toposar Vial. It's important to keep all medications out of reach of children and pets. Do not dispose of Toposar Vial by flushing it down the toilet or pouring it into a drain unless specifically told to do so. Instead, make sure to discard the product properly when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.